least 3 people have died and another is missing after a boat sank in freezing waters near Staten Island in New York. The US Coast Guard launched a rescue operation following a distress call that the boat was taking on water. 5 people were pulled from the sinking vessel, but only 2 survived. One of those rescued is in a critical condition.
So we have a 20-year-old early 20s found in a boat accident down for about 45 minutes. Vitals in the field, her respiration was 48 in the field, core temperature was 32 degrees Celsius, and her BP is 90/58.
All right, let's take it to the trauma room. All right, let's take these back clothes over. Let's warm up. All right, let me check for airway seems intact. Let me check for okay. Really diminished breath sounds. Let me check for pulse. What's the core temperature?
32 degrees Celsius.
Okay, no pulse. No pulse, code 999. Let me get the cardiac part. Roll. Start CPR.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 21, 22, 23, 24, 25, 26, 27, 28, 29.
How long has she been down?
2 minutes. Okay, switch.
2, 3, 4, 5, 6, 7, 8, nurse, 31, and chip, epi.
16, 17, 18, 19, 20,
21, 22, 23, 24, 25, 26,
20, 29, 30. Squeeze. Push.
Happy given.
Checking for pulse. Checking for BP. No pulse.
commencing compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Nurse, get second dose of LE.
Squeeze. Check pulse.
1 minute on epi.
No pulse.
Second dose of epi, push.
Epi push.
Alright, checking for BP. Alright, I got a pulse, but it's very slow.
Very faint S1, S2 sounds heard. Alright, we get this off. Nurse commence the warm saline.
Warm saline.
Let's get her warm. Nurse, vital signs please.
O2, 92.
Blood pressure.
Now, blood pressure now is 100/70.
O2 at
92%. Core temperature is at 30.5.
okay, great. She's stabilizing. Let's get her ready to go to ICU. Okay, let's go.
Hypothermia is a condition in which the body's internal or core temperature is below 32 degrees Celsius or less. This can be due to exposure to cold environments or the inability of the body to maintain its internal temperature. When monitoring a patient who is hypothermic, the A, B stages are essential to life support. That's the airway, breathing, and circulation. We will be monitoring the patient's vital signs, their CVP, the urine output, the arterial blood gas, and the blood chemistry. That includes the bun, the creatinine, the glucose, and the electrolytes. Then we'll have to do a chest x-ray to evaluate and determine any injury to the lung, the heart, and the chest wall. We will be continuously monitoring the patient's temperature with a esophageal, bladder, or rectal thermometer. So we will also be monitoring the patient's ECG frequently for ventricular fibrillation. As the patient temperature increases from 31 to 32 degrees and higher, the blood from the peripheral, the cold blood from the peripheral tissues has high lactic acid. And as the blood returns to the core, it causes a significant drop in core temperature and potentially cause cardiac arrhythmias and electrolyte imbalances. In addition to the ECG monitoring, we're going to need a defibrillator. For a patient whose body temperature is less than 32 degrees Celsius, they can possibly experience ventricular fibrillation spontaneously if they're moved or if they're touched. For a patient who might be experiencing metabolic acidosis, we will be administering sodium bicarbonate. And lastly, we will be inserting an indwelling catheter, urinary catheter, to monitor the urine output and renal function of this patient.
Active internal cord rewarming methods are used for moderate to severe hypothermia, less than 28 degrees Celsius to 32.2 degrees Celsius. IV administration of warm IV fluids to correct hypotension and to maintain urine output and cord rewarming. Also using humidified oxygen to maintain tissue oxygenation. Passive active rewarming used over-the-bed heaters to the extremities and increase blood flow to the acidotic and aerobic extremities. Active external rewarming used for air-warm blanket care must be taken to prevent extremity burn from these devices because the patient may not have effective sensation to feel the burn.